I'm talking today to Psychosexual and Relationship Therapist Shanta Gyanchand. Shanta works both in the UK and in India. Hi Shanta, how are you?
Hello Joanne, I'm fine. Thank you very much. How are you?
Great, thank you. Shanta, thank you so much for agreeing to be interviewed by Askimo for our International Library of Interviews with Experts. Today we're going to be talking about your troubles. Shanta, the first thing I want to ask you is, what is psychosexual therapy? What is psychosexual therapy?
Psychosexual therapy is a branch of psychotherapy which specializes in all areas of sexuality and human relationships. Psychosexual therapy looks at the physical as well as the emotional side of sexuality and how these two interrelate.
In what areas can you help men and women?
Well, psychosexual therapy is very vast, actually, for a specialized subject. We can help couples who are having any difficulties with sexuality. We can help couples whose sexual life has been affected by either time. It may have been affected by affairs. It may have also been affected by fertility issues, and fertility treatment can sometimes affect the joy people have in sex and sexuality. I can also help individuals with anything to do with sex and sexuality. For instance, phobias, premature ejaculation, erectile difficulties, also fetishes which seem to be taking over someone's life, sex addiction, and any other areas where people feel their sex life isn't as they'd like it to be.
Is a healthy sexual relationship important in a marriage? And if yes, why?
I would say yes, if it's important to both individuals in a couple. So if neither really care that they're not having sex and they still feel they have a intimate and happy relationship and their libido isn't that high on either side, then, well, no, it doesn't have to be a problem if it's not a problem for them. But if either partner feels unsatisfied in their sex life, then there's a problem, then it's important. If either partner wants to have a fulfilling sex life, then it's important. It's also important because during sex we bond, and during sex we feel the most intimate. And during sex, we reveal parts of ourselves we don't reveal the rest of the time. And in a relationship where we want to have a relationship with someone, we can really trust them and they really understand us, that part of ourselves is quite important.
If sex is declining in the marriage, what advice can you give couples for rekindling intimacy?
Well, it depends very much on why it's declining. If it's declining because one person has less libido, first and foremost go and make sure there's no physical underlying problem. Also find out if there are any stresses or anger in the relationship which may be affecting your sex life. If it's because, and this often happens, people get used to each other and they simply fall into a role, then I would suggest making time to have more sex, making time to have romance, and spending some time thinking of your partner in a different way. We tend to fall into a pattern in our lives, and we tend not to think of the people we feel are safe as very exciting as well. So if we have a safe wife at home or a safe husband, and they're the person we can always rely on, we can feel less excited by that person, and therefore also less sexually excited by them. So spend some time maybe seeing your partner outside your usual routine, and see how attractive and exciting they are in themselves and their lives.
If you take the example of where one person wants sex once a week and the other partner wants it once a month, what can you do so that both partners can come together on the same page?
Well, first of all, I'd ask them, what is sex? I think many people think of intercourse when they think of sex, in which case lesbians never have sex according to these people. So I often ask couples, well, if you think lesbians have sex, why can't you do the same things that a lesbian couple would do? Why do you have to have intercourse? So sex can be very wide. Maybe not both partners feel like having intercourse every week, but both partners might feel like doing something sexually each week. Another piece of advice I'd give couples where one has a lower libido than the other is the one with the higher libido can feel lonely and frustrated and also abandoned by their partner. So the one with the lower libido can give the person with the higher libido space, literal space to feel sexual by themselves. Sometimes if the one with the higher libido is getting frustrated, the person with low libido will run them a bath, give them a massage, even whisper a sexy story in their ear and tell them that the next time they have sex, they'd like to do those things. And the partner who then wants to go and off and masturbate can masturbate knowing that their partner wants to have sex with them and use them in their fantasy life.
If we were taking examples like vaginismus or erectile difficulties being the problem, are these not medical issues rather than issues that can be helped with therapy?
Yeah, these again depend on the situation. Vaginismus, which is the tightening of the vagina during sex, which causes pain, most of the time that's a psychological issue, though it's responding physically in the body. That can definitely be treated through psychotherapy. And that's happening because a woman has either had a trauma or is just feeling tense at some point and not relaxing fully. And then the pain, the fact that she feels pain, that creates a cycle where the next time sex happens, she tightens up again. So by finding out what the underlying reason is, finding out what other stresses there are in her life, and taking time with her partner to feel more relaxed, she can enjoy sex fully. If she wants to have sex with her partner at all, that can sometimes come up. And erectile difficulties, they can be physical, but often they're due to stress or they're due to unconscious difficulties with the partner which the man isn't aware of. And even if there is a biological issue, sometimes adjusting can be difficult in and of itself. Sometimes erectile difficulties can be because of diabetes. And if they don't rectify themselves, a man may want to go to a psychosexual therapist to rethink his sexuality and to still have an enjoyable sex life.
Some couples have sexless marriages. What questions should they be asking themselves to try and figure out what the problem may be?
Some couples do have sexless marriages, and that is a problem if they aren't being honest about whether they're happy with that. If either partner, and there usually is one or other partner, really want to be having a sex life, then they should be asking themselves, why have they let this go on for so long? Why aren't they bringing it up in the relationship? What are they afraid will happen if they bring it up in the relationship? Why are they allowing themselves to see their partner as a non-sexual being as well? Are they assuming that their partner is non-sexual? And if their partner isn't interested, why isn't their partner who cares about them interested in their enjoyment in some way? So even if one partner has no libido and is absolutely fine having no sex and would rather it that way, there should be some concern that their partner has a need which isn't being fulfilled, and that should be in some way being dealt with, not if caused by a person who's not interested in sex having sex, but interacting in some way in their partner's sexuality.
Thank you, Shanta. Thank you so much for talking to me today.
Thank you once again, Joanne, for asking me.